Hi, my name is Donna Crawford. I'm a physician assistant here at the Veterans Administration, and I am here on behalf of the Diversity Committee from the Georgia Association of Physician Assistants. And I want to introduce you to one of our outstanding physician assistants here at the Veterans Administration. And she's going to start talking and just tell you a little bit about what she does here at the VA. So I'll let her introduce herself.
Thank you, Donna. So my name is Beatrice Johnson, and I'm a physician assistant here at the VA in Atlanta, Georgia. I'm a graduate of Charles Drew University of Medicine and Science in Los Angeles, California, class of 1999. And I've been board certified since 2000, so it's been 23 years practicing as a PA. I started in family practice, rural medicine, and many other specialties. But in 2013, I accepted a position at the Birmingham VA in the surgical service for plastics, hand, breast surgery, and surgical oncology. In 2015, transferred to Atlanta, Georgia to orthopedic surgery, and brings us to today. Now I'm a spine surgery PA here on the service.
Okay, that sounds great. So what inspired you to come to the VA?
Well, my father was a veteran. He served 21 years in the military, first the Navy, and then retired as an Air Force retiree. And in his retirement, was a patient of the Jackson, Mississippi VA.
Okay.
And I was impressed with his care.
Oh, wow, that sounds great. So we would like to know a little more about what you do. So explain your day in the life of a PA here at the Veterans Administration.
Okay, so an average day for me starts between 7 and 8 o'clock here at the Atlanta VA in the surgery clinic. I screen consults, and those are requests for veterans to be seen by the spine surgical service. They come from primary care, emergency, and other specialty services that feel like the patient may be candidates for surgery for spinal degeneration or even for simple complaints like low back pain. So I start off with that. I also see patients in clinic face-to-face, some virtual and by telephone, some of those, but most are here face-to-face. I order diagnostic studies, I look at their labs, I look at all of their overall health and decide if they may be candidates for surgery. If they're not, I make recommendations for non-surgical treatment. Also in a day, I respond to lab results, contact patients with those. I also complete notes and make recommendations and do e-consults for other services requesting patients be seen.
Okay.
Yeah.
We know now a little bit about your role here. I also want to know about your patient population. We know that we primarily serve veterans, but just tell us a little bit about the diversity of the veterans that you serve.
Yes, so most of our patients, as you know, are male veterans. However, we do have, I believe, a significant population of females. I think maybe 20 to 25% of our surgery patients are females. We also have a wide variety of ethnicities and a wide variety of age ranges. So we can see patients that actually have already had surgery in their 30s. We see patients in their 20s even. But surgical patients, the range can be from 30 to 90. Okay.
That sounds wonderful. So as part of PA Week, we are actually adopting the theme of PAs Go Beyond, and we know that a lot of our PAs have gone beyond service. I want to know how your role here at the Veterans Administration goes beyond. How would you describe that?
Well, for me, my role goes beyond my job because personally, I think it's important to empower each patient. Here, particularly our veterans, to advocate for their own health. And so it's important for me to know that they understand their conditions. Mm-hmm. So I create educational tools, you can call them handouts and things like that. And I do a lot of teaching within the visit. And sometimes I add visits and invite the patients to come back with their families so I can explain everything to them and answer questions. So that's one way.
Sounds great. As part of PA Week, we want to share light on our veteran PAs here. Our current goal is to get more and more involved with the community during the PA Week, and what better way not to do that than serve our veterans. So on behalf of myself, Donna Crawford, I would like to say Happy PA Week to everyone, and this is the day in the life of a Veterans Administration Physician Assistant. Thank you.
Thank you.